Hi, I'm Linda Clement, Chief Nursing Officer here at KSB. I'm proud to kick off our Brain Health series within KSB and our community. We kicked off our series last year at the Elks Lodge, and then COVID hit. COVID hit everyone, and we at KSB want to be supportive and help you navigate through these trying times. Last year, our KSB Board of Directors requested we focus our efforts on brain health in 2020. Even pre-COVID, our Community Health Needs Assessment survey told us that 50% of our household members in Lee County experienced a brain health issue in the past year. Last year about this time, KSB received a proclamation from the City of Dixon declaring 2020 as the year for brain health, stating that the brain is an organ susceptible to disease and disorder. We have decided to extend our efforts and focus this cause throughout the year of 2021. KSB has many teams working on initiatives that relate to this overarching brain health campaign, like our Zero Suicide Initiative, depression screening for patients 12 years and older, integrating social workers in our primary care clinics. KSB has also received a couple grants equaling $2 million to work on opioid stewardship. Project Open is the name of this team, and they have members from Lee County, Ogle County, and Whiteside counties, with the goal is to implement prevention, treatment, and recovery strategies to lessen the devastating effects of substance use and social determinants. KSB continues to partner with the Safe Passage program for people who need detox and rehab. As we continue to be a part of the Lee County Crisis Prevention Team, working hand in hand with law enforcement, the state's attorney, and Sinisippi to help keep our very sick brain health population as healthy as possible. We are really excited to launch our electronic brain health questionnaires to our community to help people determine resources they might need. So what is brain health, and why is KSB trying to get the message out that words matter? The main point I'm trying to make is that brain health shouldn't be treated any differently than conditions like diabetes or heart disease. We shouldn't be embarrassed to talk about it. We want to stop the stigma so people get the care they need and deserve. With that said, I want to turn it over to David Steiger, our Director of Behavioral Health Care here at KSB. He's going to talk to you more about navigating the effects of COVID in terms of brain health.
Hello, I'm David Steiger, Director of Behavioral Health here at KSB Hospital. Thank you, Linda, for a great kickoff to this discussion. Talking about brain health is often an uncomfortable discussion because it comes with a lot of baggage. When a professional becomes involved with someone who is struggling with a brain health issue, there's a lot of unpacking to do. Like with most diseases and illnesses at one time, they have been the subject of a rude comment, jokes, and outright ridicule. What I'm describing to you is something that Linda spoke about, a social determinant. These are factors that determine if someone will seek, attend, and follow through with assistance. It is rooted in the past and with other less desirable words. It lends itself to the idea of what is wrong with you. According to the National Alliance on Mental Health Illness, 20.6% of U.S. adults experienced mental health illness in 2019, which is approximately 13.1 million people. That represents 1 in 20 adults. However, less than half, 43.8% of adults with mental illnesses received treatment in 2019. As I've mentioned, there's a lot of stigma surrounding this issue. If someone is injured in an accident, as supportive friends and family, we don't ask the person what they did wrong, nor do we ask the person with cancer what they did to get it. A social norm that has been practiced is the person with a brain health issue is asked, what is wrong with you? And why are you not talking or acting right? Often people who are struggling with brain health issues have been met with a lot of judgment instead of understanding. In the case of any other illness, we would meet with the professional and develop a plan of treatment. We would want to know our options, the length of treatment, and the effectiveness of said treatment. Why would we treat brain health any differently? The statistics provided before was from 2019, the pre-COVID pandemic. In a different nationally representative survey that was conducted prior to COVID, the results were 9% of people reported brain health issues. They repeated the survey between March 31st and April 13th of 2020. The number had tripled, with 28% of people reporting brain health issues. Individuals who have been dealing with a brain health issue that have sought support through therapy had been working to incorporate their specific symptoms into their lives. As an example, I worked as a therapist in private practice. When I would work with someone that had been diagnosed with depression, I would often recommend they counteract some of their symptoms with social interaction. If you don't feel like being around people, or if you just want to stay in your home, try going to the grocery store or the library. It is a short-term, non-committal interaction. The act of getting yourself ready, walking, being out in the sunlight, and talking with someone, even if it is the cashier, and telling them to have a nice day, can change someone's mindset toward feeling better. When the pandemic hit, people were no longer able to have that limited social interaction. It was a devastating blow for those who are already dealing with a brain health issue. As I reported before, the numbers are growing, and it's due to the isolation. People are having more incidents of brain health symptoms. It was the unintentional consequences of the pandemic lockdown. People have been instilled with fear from contracting the virus. Our community, state, and federal leaders have put mandates for us to remain in our communities and preferably at home. It has severely impacted those individuals who are already dealing with a brain health issue by increasing the severity of symptoms, as well as those who did not previously report any brain health issue are now reporting symptoms of depression and anxiety. I hear reports from brain health professionals that when they are contacted, they are told by prospective clients, I am so afraid to go out in public because I don't want to get the disease. Or, I'm going stir crazy. I can't sit down. I'm so nervous. As a society, we have a very efficient method of explaining these symptoms away. I have cabin fever. It will go away when I can come out. I'm bored. Where some of these explanations could have impact on symptoms, they do not account for all the symptoms. I feel that I have painted a very dark outlook. I don't want you to think this is hopeless. The good news is there is a vaccine available. Restrictions have been loosened up. We will be able to go out and be more social, which will only help in part of a brain health issue. Some form of therapy is often recommended, even if it is in the short term. But how do you get from here to there? There are safeguards that need to be followed, such as social distancing, wearing our masks, and hand hygiene. Check with your brain health professional to see if there's an alternative form of meeting face-to-face. Another format that has been developed to help with this is KSB has been working to bring you a wonderful online platform called Hypnosis. Akil Khan will be discussing with you the ins and outs of the platform. There are several assessments that can be taken which will help point you in the direction of assistance. A few of these assessments are for depression, anxiety, substance use, and trauma. Given the outcome of the assessment, you will be provided with some resources, have the availability to speak with a professional, or be directed to seek immediate care. With your help, we can put an end to the stigma surrounding brain health and help more people seek the treatment they need. Thank you for listening. And now, Akil will give you a demonstration of the Hypnosis platform.
Hello, my name is Akil Khan, and I'm a member of the team which developed KSB's new Brain Health Questionnaire. We are very excited to launch this resource to our community. I love when Linda said the brain is an organ susceptible to disease much like the heart or lungs. And as David mentioned, when someone visits the doctor for a heart or lung issue, we do not judge them or question or ask them what they did to cause the issue. Instead, we develop a treatment plan, explore medications and other therapeutic options in a shame-free environment. Our goal with this brain health campaign is to help reduce the stigma and help people feel comfortable around having the conversation about their brain health. And one of the ways of starting this conversation is through our new intuitive questionnaires. If you've been keeping up with our telehealth series, you'll remember the virtual care button in the upper right-hand corner of ksbhospital.com. You will access the brain health questionnaires in the same area where you access our 24/7 urgent care platform known as KSB Care Anywhere. After selecting Get Care Now, you will arrive at ksbhospital.zipnosis.com. You can enter in this web address directly and skip the previous steps if you like. So we're going to log in. If you don't have an account, creating one takes less than 2 minutes. Once you log in, you will select the patient for which this visit is for. You do need to be 18 years or older to create an account, so this is where you can add any dependents and complete visits for them, or let them complete one of our brain health questionnaires if they're able to do so. Over here, we're going to select the brain or mental health tab. And I'd like to highlight the fact that submitting these questionnaires are free. And this is because we recognize the difficulty many already face when seeking professional help for their brain health concerns. And we want to remove as many barriers as possible, starting with the financial one. Limited access is another barrier we are removing by making these questionnaires available 24/7. So we will get started with the visit and complete our initial screen. To ensure we are providing the appropriate care, we have a global screen out question to help individuals who may have an immediate need and get them directed to the appropriate resource, such as the crisis hotline, 911, or the nearest ED. If you are not experiencing a crisis, select no, and then you will find the page where we have all the questionnaires we provide. From ADHD to anxiety to depression and post-traumatic stress, we've got these questionnaires. Linda mentioned our opioid grant, which was the inspiration to add substance use concern pathways for either drug and/or alcohol use concerns. If the selected patient was under the age of 18, pediatric pathways for emotional and behavioral concerns, as well as substance use concerns, would be available to select. Completing one questionnaire only takes a few minutes. A member of our care team will review your response and reach out to you with next steps, either via phone or a face-to-face telehealth visit, whichever you prefer. From 8 a.m. to 8 p.m., you will get a response within 4 hours, and any nighttime visits will get a response by 9 a.m. the next day. Brain health concerns were already high in our area, and they've only increased in the last year due to COVID. Please consider using this tool to get started on your care journey. Our care teams are here and ready to help you experience and achieve more positive brain health days. Thanks for listening.